Hi, I'm Daniel Nyman, Director of Business Development for the Forum for Healthcare Strategists. On behalf of the Forum, as well as our partners at Loyal, welcome and thank you for joining us. It's not news that healthcare consumers and patients have high expectations of their healthcare providers, especially when engaging via digital channels. As healthcare consumers, we all expect to have the answers to our healthcare questions and needs available at our fingertips. While there are many components of a successful digital strategy, today's webinar will focus on one imperative, foundational element, data management. Our speaker today is Rachelle Montano, Vice President of Clinical Strategy for Loyal. Rachelle has more than 20 years of experience developing and implementing digital strategies for organizations to successfully connect and engage with consumers, customers, and patients. At Loyal, she oversees strategy and development of the taxonomy for the Loyal AI-based chatbot and runs Loyal's clinical review board. One note before we begin, while attendees are participating in listen-only mode, we welcome your questions. If you have a question for Rachelle, simply enter it into the question and answer pane located on the bottom of your screen at any time. Now I'll turn the program over to Rachelle.
Thank you, Daniel. I appreciate it. And thank you to the Forum for Healthcare Strategists for giving us this opportunity today. I'm so excited to talk, and there's a lot to cover. So without further ado, I'm going to go ahead and get rolling. Okay. So since we're talking about data management, I wanted to start with a knowledge graph about me, and because it starts to showcase visually how data about people or about anything connects together and starts to create relationships. So I took this idea from a good friend of mine who gave it to me, and I'm like, oh, this is perfect. I love the way that it starts to build in the importance of data. So anyway, Daniel's already told you a little bit about my experience. But I also am married. I live in the Outer Banks of North Carolina. Anyone who's on the call, who's known me for a while, know that I have lived in Florida. I recently moved. So if I were still in Florida, I probably would not be able to be with you guys today because I'd probably be in the middle of the hurricane watch party for Hurricane Ian. And so I am thinking about all of our friends and families and colleagues that are in Florida, and hopefully it's not too bad of a storm for everybody. I have 2 dogs, 2 kids, and then a lot of experience within the industry, and a lot of experience both as a healthcare provider. I started my career as a dietitian, and then also I've been helping do digital strategy with hospitals for about 20 years now. So without further ado, or just have a little bit of information about Loyal. So Loyal is a healthcare exclusive company. We focus our solutions on helping health systems and patients navigate their care experience. So we're headquartered in Atlanta. We've completed a Series A round of funding. We have about 160 or so employees. And we work with multiple health systems. We have about 35 current health systems who are using our platform in some fashion today. So large, small, all across the country. We have a multi-experience consumer health platform that helps consolidate data from multiple sources, put it in a format that helps people, health systems and patients use it to help optimize their care journey, and then as well as help to optimize the business experience. So we think a lot about data all the time. It's really the core of what we do. And so that's why part of why this topic today is really so pertinent, and I'm excited about it. So what we're going to do, we're going to get into and start to talk about some of the challenges and trends that are experiencing or happening within the industry today. And then talk about high-level components of a successful enterprise data management solution, and then other things that help support your data management initiatives to help meet patient expectations. And then we'll have some final closing thoughts, and then we'll end with Q&A, opportunity to ask any questions. So I wanted to start really with a personal story. It always helps when you start to bring in storytelling to set the stage. But almost 3 years ago now, January 2020, so just before the world changed, I took my daughter on a cruise for her birthday, And really that part's not totally relevant to the story, but when you fast forward a couple of months and you realize we were on a cruise in January, couple months later, a couple weeks later, after we returned, we were at a basketball tournament. She was playing on a AAU basketball team, so we were we were in a tournament out of town, and she started to feel pretty sick. She's super competitive, and so she, you know, the cough and fever, she still insisted on playing. And when I look back now, I'm like, oh, I can't believe that I did this, but it was a different world then. And so while she was on the court, I noticed she was having trouble breathing and coughing a lot, and her coach still had her out there. And I'm here in the stands wondering what to do. And I realized we had telehealth. And so from the stands, I actually did a consult with a doctor. The doctor called in a prescription. Again, we're out of town, so called in a prescription to a nearby pharmacy. I ran out, left the gym, picked up the prescription, came back, gave it to my daughter, during the timeout. So she never had to even leave the court to get her prescription. And I remember thinking, wow, what an experience that was. It was so easy. And the only thing that would have made this better is if they delivered the prescription, like it was, like a pizza. Fast forward a couple of weeks, COVID happened, everywhere, the world, shifted and changed. And we were all forced to, face this new normal. And health systems were forced to figure out how to really meet this change needs and expectations of consumers. And so healthcare in general, right, is a very large, powerful, established institution, right? We are entrenched in the world. But yet this rise of consumerism, and especially what happened, during COVID, has really put some extra pressure on us within healthcare, and really starting to allow consumers to exert more power on us and more demands on the provider-patient relationship. And so we're really starting to expect to be treated the same way that we get treated in our daily interactions with retailers when we go to see our providers. So in some ways it's hard to not look and wonder if the tail's wagging the dog. And so in itself, I think this is great for us as consumers and as people, but it is very disruptive time for traditional healthcare. So to that end, beyond COVID, we also are experiencing disruptors from outside of healthcare. And this is really having an influence on how providers are looking at the services and care that we're providing. Things are, we're in a rapid state of change currently. I would think within our healthcare institutions in general, the patient journey at its core really has remained the same. I mean, you have a healthcare problem that you need to solve. You do some research, you can do it online, you can talk to a friend, you can talk to even a doctor. Figure out what your plan is, become aware of your plan, schedule your appointment or your interaction, or schedule your plan, prepare for it, go through it, and then you have the follow-up and the next steps, or paying your bills and things like that. I think that the core journey has very much remained the same, but what has changed is the complexity with which the choices that we have are made. How information is accessed or communicated, and data is really gotten much more complex, and especially over the last couple of years. I think that also we as consumers, another thing that COVID has given us is it's given us more of a willing to take risks and experiment and try the telehealth experience, try something. And I think that, has really also, helped influence the way that the expectations of what patients are looking for within their healthcare journey. And so what's happened over the last couple of years is healthcare providers rushed out to meet the market pressure from the pandemic, and they implemented point solutions quickly, somewhat myopically, I think, too, to just kind of meet the needs, get it out there fast. And so while I do think digital enablement has slowed, is starting to slow. That rush, that sense of urgency has somewhat waned recently. I don't think the expectations of our consumers has. So I think we're still feeling that, and we're still also certainly feeling pressure from outside disruptors in healthcare, right? That's not going to go away. And so as a result, of that rush to deploy things, lots of health systems have a tech stack that looks something like this, right? You've got lots of vendors that you're working with who are helping to solve one piece or part of the journey, of the experience, and that's a challenge to manage. And also from a patient experience perspective, your experiences are disjointed. Your data is dispersed amongst many databases, and so there's, we're still in a very much of a state of disruption at this point. And so really what we're experiencing, I think, is this point solution overload. Many health systems have deployed solutions that have overlapping capabilities, are expensive, there's the disjointed experience, and that there's no really clear visibility across the entire patient journey. Thinking back, my initial story about the gym experience, that telehealth visit was not connected to the EHR or my daughter's primary record with her pediatrician. And so it was up to us to report it. That type of experience is happening everywhere today. And then there's also just this explosion amount of data. I mean, not just those point solutions, but also just with the way that technology has grown and evolved, and artificial intelligence, like we're tracking with our access and ability to see data is just mind-blowing, right? So what has happened within our healthcare organizations is siloed, disparate sources of data, multiple stakeholders. Think about if you work within a healthcare organization, just the data about your providers or your care locations. This information tends to get managed in multiple areas. You have your credentialing system that's tracking information about your providers, where they're allowed to work and provide care, what type of care they're able to provide. Your EHRs are also tracking information about your providers and your locations. And all of that information was really not designed with the consumer experience in mind. So it requires really a concerted effort to collaborate across departments and bring it all together to develop a much more cohesive patient experience. And so enter bring in enterprise data management. When you think about the definition of data management and who's responsible, typically kind of that falls into your IT department, right? Data management touches departments across the organization. It's more IT, kind of what they do is deploy technical solutions. And so, IT tends to be responsible when it comes to deploying enterprise data management solution. But what I wanted to talk to you guys about today, or what I think is so important, is I think us as digital and marketing experts, our expertise, lies in understanding the needs and expectations of consumers and patients. And really, it's part of that expertise that's we need to bring in and own when deploying a data management solution. And we can't just let it be an IT solution. It has to be something that that we own as well. But I kind of already touched on why data management is a challenge, right? Data lives in multiple areas throughout your organization, lives in multiple formats, disparate, systems that don't talk to each other. Of course, we're in a highly regulated, and the need for security is so high when it comes to healthcare. So there's lots of challenges that we're facing when we think about managing data. This just is scratching the surface, right? And so I like this quote. This actually, I just was at a conference recently, just a couple of weeks ago, and talking to a VP of marketing, and she was like, oh, we need help because we just have this archaic system. Our patients, there's no, disjointed patient experience. And what I end up spending my time is getting into operation issues and helping, trying to figure out how to resolve those issues. And that's where, again, I think that we need to bring everybody to the table in order to be successful. So I wanted to talk about a few components or pillars when it comes to successful data management. And so all of these things have to be considered and all work in sync in order to be successful: strategy, governance, and implementation. So thinking about strategy, it's always, when you start out on a journey, when you start with any sort of project, you really have to know what it is that you're trying to accomplish. So really clearly defining your goals, clearly defining your problem, and know what it is you're trying to solve. That's how you're going to be successful. Without that, your project is not going to be a success. But beyond that, you really need to make sure that you bring organizational alignment as well. So make sure everybody's aligned on the same goal and all working together. That's so important. So if you're trying to improve the patient experience by improving access to care, making sure that you're aligning all the departments who are impacted by this. So, your contact center, who's going to be taking those additional calls that you're going to be driving, office managers who are going to be, putting in those additional appointments, operations, making sure that if more appointments are coming, there's parking available, there's the additional supplies that are needed for all of the additional surgeries that might be scheduled, the cleaning of the rooms, like everything has to work together for every one of these initiatives. And it's thinking even beyond the data that you're doing, but how are you impacting the organization, even more broadly. So kind of to that end, when you move into the implementation phase, making sure that you have stakeholder alignment and support for your goals and objectives is so important. And taking the time to think through everybody's workflow in the process. Making sure that everybody who touches, uses, needs the data, you've thought through what it is that they do, and engaging them all early on in the process is important. I think I like the last bullet here, understanding your organization's tolerance for operational disruption, because when you're putting a new system like this in place, disruptions happen, right? And I think COVID, right, has really pushed us much further along in the continuum for acceptance of operational disruptions. But it's also at the same time, there's kind of a backlash against that because we're exhausted. This is just too much disruption, and now you're asking for another change. And so I think you might be met with some resistance when you try to deploy some of these solutions. But it's important to understand where your organization is and figure out how to bring it along as you're deploying any sort of data management solution. And then, of course, when it comes down to the actual implementation, developing a data model and plan is an obvious, step in the journey. So when you're doing this, making sure that you've identified all your data sources, that sounds simple, but it's not always so. Sometimes the data sources aren't digital at all. Sometimes they're information that's about a physician's schedule or about a thing is just actually a sticky note attached to someone's workstation or in an Excel document that is just within one department. And so making sure that you take the time to think through all of the detailed data requirements is so important. Of course, security, consumers in particular, healthcare consumers are very sensitive to data security, and security breaches unfortunately continue to happen. They're at an all-time high. So just important to think through that part of the component of whatever solution that you're deploying, because we have to continue to maintain the trust in our patients and consumers and not not let security get in the way of that, or any security breaches get in the way of that. So governance is the third kind of pillar and component that I wanted to touch on today. I think a lot of times this component gets overlooked. I think, even if IT is leading this initiative, it's important to keep all stakeholders engaged in the governance process. Data management, it's not static. Updates happen, things change, policies need to be established for how to manage that. It's important to have a communication plan in place to help, keep everyone apprised of progress, continue to get support and buy-in. I'm a big fan of multidisciplinary steering committees. I think, you don't want committee overload, and you don't want to have so many meetings that people just, meeting overload. But I think it's important to get that multidisciplinary support, and maybe, finding a committee that's already in place, that already exists with another objective, and see if they don't mind taking on a sort of a data management project. That could be a good approach when thinking that through. But governance is imperative for a successful data management plan. So beyond those three foundations, just a couple other things I wanted to touch on and consider. So we've talked about, I've already touched on the kind of the first three items here. So understanding your health system and developing a strategy with clear goals. We talked about some tips for building and implementing your foundational data management source of truth. Touched on governance structure, but of course, to be successful, you have to engage beyond just the stakeholders, but all employees across the organization. Make sure that everybody feels empowered and connected to your common goal is just so important. And then, making sure that you are actually meeting the expectations of your consumers and patients while you're doing it. I threw these in because I think, it's not a secret, right? Because there's all the conversation about the Great Resignation and all of the changes in the way that people are rethinking their careers, and the labor market has seen huge fluctuations and pressures these last few years. So it kind of, something to consider, of course, while we're putting together this, thinking about deploying a data management solution across your organization. The middle graph here is particularly interesting to me. I think that just shows those in the labor force who are 25 to 54, their participation in the labor market. And you can see it took a big drop in 2020. I think it's interesting. It's really come back almost to pre-pandemic numbers. I don't know exactly what that means, but just means that, I don't know, it's kind of interesting to me to see that, that we're still seeing a shift, I think, in the labor force. But this headline has made huge press and a lot of headlines over the last year that essentially 1 in 5 healthcare workers have quit their jobs since 2020. So that's 20% of the healthcare workforce has left their job. But really, when you dig into the statistic more, what you see is that most of those workers have actually moved on to another role still within healthcare. Once you work in healthcare, you can't, it's in your blood, it's something that you love, you do it because you're passionate about it. But they are moving and they are changing and they're leaving their jobs. When you talk to people, it's primarily because of burnout. And it's understandable, right? We've had a crazy amount of stress and expectation on caregivers over the last few years, and what we've experienced at the health system, it's a lot. It's a lot. Endless hours, not a lot of relief, a lot of pressure. So you can see why people are feeling, overwhelmed with their jobs and wanting to make a change. So then when you add on the need to learn a new technology or something, that changes what they're doing, it just adds a burden, and it just can be really, really overwhelming. And so I like this quote that whatever that you do, it just has to be dead simple for frontline employees to adopt new software. I think you know, of course, but it's even more important given where we are with the labor force and all of the pressures in the way, workforce today. So, um, change is stressful for anybody, right? And if you add a new thing to somebody, it can really stress people out. So, you really have to make sure that you're engaged, finding ways to engage them and employ and keep everybody as a part of it, and feeling a part of the success is so important. So I have a couple of quick tips on how to build employee engagement. So really, finding your champions, leverage the excitement that someone who's wants to be engaged, being an early adopter, is so important. Using that to help convince the rest of the employees to use it is important. Early on in my career, I was working as a registered dietitian in a hospital, and I was actually part of the team, selected to be part of the team that trained and helped roll out the very first EHR that was happening in this hospital. And when I think about, and I had a job, I was running training sessions for nurses and doctors throughout the hospital, these very experienced, much more experienced people than I was just young, one of my first jobs. And I think, I look back and I'm like, did they put me, who I knew nothing, as part of that task force? But I think it was part of, because, my passion for what we were doing, showed. I maybe, just not smart enough to not raise my hand and know, what kind of challenge that we were getting into. While everybody else had a little more experience, we're like, no, I'm not gonna touch that. But, maybe that was a part of it too. But, but I think about it's finding your champions and being able to, find those people that can help support your cause and help convert the people who are, more skeptical or hesitant as you're doing something. And then, the age-old marketing technique of, what's in it for me. So always thinking about when you're communicating and doing something, how does it impact, or, how is it helpful to the individual's job, the mission of the organization, improving the patient experience, how that will help not only the patients and, that we're giving care to, but also the organization, and make your jobs easier. So kind of bringing it back to the consumers and patients, I mentioned at the beginning that the patient journey is very much the same. There's, nuances and obviously to it, but essentially it's the same. But even while you're moving through that journey, your needs do change as you move through it. And so whatever plan or strategy or solution that you're putting in place, you need to make sure that you're thinking about considering the needs of the consumer where they are in their healthcare journey. Always important. They're always at the center of everything that you do. And really, at the end of the day, it is not as easy as just a straight healthcare, straight path or journey. The way that people are looking for and accessing care is a tangled web. I mean, they are, thinking about symptoms, what's going on, what conditions they have, do they need to still be diagnosed, are they undergoing treatment, what are the doctors, the specialties, the services, and where can they get the care? It's this tangled web. And so this is only, of course, just shows that it is a complex problem that we're trying to solve all the time. And so, it's not easy, and it's not going to go away, I guess, is kind of the point of this too, is like the confusion of the consumer is going to continue to be there. And we have to find ways and strategies to help meet them where they are. So just a few closing thoughts. I've touched on a lot quickly. I feel like I've been talking very fast. I'm sure I have. But kind of just some high-level points that I want to make sure to drive home. First, I think consumer expectations from your healthcare experience are going to only continue to strengthen. COVID pushed us fast towards that. I think, that's not going away, and it's only going to get stronger. And so as healthcare providers, not only do we feel that pressure of the consumer expectations, but we're also, continuing to feel pressure from multiple other sources, disruptors that are coming into our space, the Amazons and they're not going to go away either. And so we have to, we're going to continue to feel pressure from multiple directions. Data management is not easy. It's hard. There's lots of sources, lots of stakeholders, and it's a challenge. Definitely, we have to recognize that and not go into it, thinking that there's simple, easy solutions to what we're trying to do. But it is a foundational element, and it has to be done and done right in order to really successfully meet the needs of consumers and patients. That's kind of the second fact. So it's hard, but it's also the foundational, super important element. And that it goes beyond just the data. So it's, and that's what I want, thinking about today, is make sure that we are thinking about our data management solutions beyond just the data and the solution that we're employing. It's also about managing the people that are responsible for it. And, that does require a special focus and skill set. And I think we as marketers are, uniquely designed to have the talent to do that. And so, I hope that everybody is, feeling like they can be champions and feeling like this is something that they can continue to help support and feel good about. And that is all I have prepared. I think I turn it over to Daniel next.
Thank you, Rachelle, for that terrific presentation. We do have several questions from our audience, and just a reminder, if you have a question for Rachelle, you can still enter it into the Q&A pane at the bottom of your screen. So with that, our first question, Rachelle, how can I convince my manager to get on board and looking into new all-in-one data management systems?
I think looking at case studies, finding other case studies, articles, things that are out there, have, lots of people are talking about this. Sharing, so finding those case studies and finding those success stories and sharing them with your manager if they're not on board. If possible, conducting your own research, like looking at your analytics, looking at roadblocks to how people are accessing cares, and looking at consumer, patient experience surveys or results and things that you have at your fingertips about your organization in particular. And then building a business case from there, figuring out how this system is going to help meet whatever business goals you're trying to do. Is it going to help save your employees time? Is it going to help improve throughput, improve the experience, make your physicians happier? Whatever it is that you're trying to solve, build a business case around there, and then and share that with your manager too, and figure it out and tell the story in the way that best resonates with your manager and your leadership.
Terrific. What do you see the timeline being generally for getting to successful data management level once a health system starts that process?
2 weeks. No. This is always a tough question. I think I have been doing this a long time, worked with lots of health systems, and no two systems are the same. So answering that question is hard, right? Just yesterday, I was looking at an article about the design of care flows, and out of the 80 people, health systems that they looked at, there were 60 something different team compositions. And so, while that's a different thing, that's designing care flows, it just shows that there's just a lack of standardization across health systems. So answering how long it will take, is really hard. There's a lot of variables at play. The level of commitment, is this initiative being driven by your CEO? If so, it'll probably tend to get done a lot quicker. Do you have the resources that you need dedicated to it? If you do, again, it'll get quicker. Or is it something you're just asking someone to add onto their plate, and then it's just, it's going to flounder and be tougher to accomplish? Having said that, though, to give you an answer, I would say, if we're, if what we're talking about is a consumer-friendly data management solution for your provider and location information, that's similar to what many of Loyal's clients are trying to deploy. And that's a lot of what, where we spend our time thinking and working. So, I would say to deploy that again, lots of variables at play, size of system, right? So it's hard to say, but 3 to 10 months probably, is something you can expect. And again, it doesn't end. It's always going to be continually, refined and evolved. But that's probably something you could consider for a time frame with the big budget aspects at the end.
That's great. Kind of building off of that, then, how can I get my team excited about making this change and doing the work once you've sort of, gone down this road?
Yeah, I mean, I think it comes down to, communication, finding your champions, finding your champions, giving them the support that they need. Celebrate small wins. That's also another important key component. I think, this is can be a very big, large initiative, and kind of find small wins and celebrate those as you go along. That's a really a good way to do that as well. And again, communicate, and always communicate, communicate up to leadership, and communicate across, across the enterprise as well.
Thank you. This is sort of a bigger, broader topic, or question. In your opinion, are health systems sticking to the traditional setups because they don't want to compete with digital health system big guns, thinking Amazon or other new entrants?
That's a good question. Not sure I totally understand it, but I think I don't think it's a matter of health systems not wanting to compete. I think it's probably more of a matter of not knowing how to compete. Traditional or non-traditional healthcare disruptors, like Amazon, are really coming in and changing the rules, and they're not playing by the same business models that traditional healthcare providers are. They don't have the same pressures of third-party payers and relationships that health systems are facing. And so, those more entrenched business pressures, changing that takes time, if it's even possible to adapt to some of the the things that these disruptors are able to do. And so, Amazon's invested billions and billions of dollars into technology and infrastructure that a traditional healthcare system hasn't. And I don't know if they should per se, because it's the objective of what why a health system is in business may not be aligned or the same as the objective and the goal and the mission of why Amazon is in business. So, and other disruptors. So, I don't know what the future holds, but what I do know is consumers are much more in the driver's seat than ever before. And, it's going to be interesting to see how this continues to shake out and play out.
Thank you. What makes a good data management solution stand out when evaluating vendors in the space, or what features, make for a solution, or a good solution?
I may be biased because, of course, I work for a data management vendor, but to me, one of the most important things is making sure that you as a healthcare system has access and controls and owns your data. It's not, again, looking at the reason why the vendor is in business. So, they're making sure that they're not wanting access to your data in order to achieve another ultimate bigger goal. They're not aggregating your data with everybody else's data to look at something, national trends, influence thing, whatever. so, looking at the reason why the vendor's in business and making sure that you continue to maintain ownership and control over your data. Number one. I think then number two, being able to be flexible in how, not only being able to view and access and see your data, but being able to be as flexible as possible in creating the relationships and managing the relationships, and that you can create different ways and unique ways to show relationships between the data points, and then surfacing them for consumers and patients in a way that makes sense for your particular health system's situation. Because again, no health system is the same. Everyone is unique. And so making sure that you can deploy a solution that meets your particular needs is so important.
Oh, that's great. So the question, I think a lot of folks always want to know, you've decided to go with a data management solution. How do you tie or show or measure ROI?
I think it goes back to when you're developing your initial strategy and plan, you have to figure out what your goals are. And so clearly defining those goals. And once you define those goals, figure out how are you going to measure achieving that. So, and then figuring out the metrics tied to that. So it's going to be, again, unique to your situation, but if it's helping connect consumers to doctors, it could be looking at things like appointment requests or appointments scheduled, or even things like that. So it just kind of, I hate to say it depends, but I do believe everything you do, you have to measure and track. And so, and make sure that whatever you're tracking is tied directly back to your goals and objectives.
Thank you. I think we've got time for one last question. The slide about EHRs taking up time and energy from doctors, are there EHRs out there trying to fix that?
No, I mean, I think that's rather cynical of an answer, but again, like the entrenched legacy EHRs as we know it, they weren't designed with doctors or providers in mind. They were designed as billing systems. And so, doctors are in the practice and business of caring for patients. They're not driven by billing or technology or, the complexities of that. And so it goes back to the point of what's in it for me, I think. And, for doctors to answer what's in it for me when they're dealing with their EHR, it's really, hard for them to. And so I think in order for us to do that, we would probably have to kind of step back and flip over the reason why we have an EHR in the first place. And I think that would be a really, it's a major disruption within the healthcare system. And so I think, having said that, again, that's a very cynical answer. I'm positive that the EHR vendors would probably, not like that answer. And if there's anyone on the line who works for one, you probably, don't like that answer, because I'm positive that there are initiatives that are trying to fix the problem of, of the negative perception that doctors and providers have with having to deal with EHRs.
Thank you. With that, we've come to the end of our program. I'm sure the audience joins me in thanking Rachelle for sharing her insights and experience today. Thanks also to all of you in our audience for joining us for this important conversation. Please note that if you asked a question that we weren't able to get to, we will do our best to get a response to you. We'll also be sending out a link to the webinar recording in the next few days, so be on the lookout for that. Finally, be sure to give us your feedback by completing the evaluation survey as you exit the webinar. We look forward to seeing you at future webinars, as well as the Healthcare Marketing and Physician Strategy Summit, April 17th through 19th, 2023 in Austin. Check the forum website at healthcarestrategy.com for details. That concludes our program. Thank you and have a great day.